Good morning and welcome to a beautiful morning here in Greece. My name's Andrew and I live here, and today I'm in Rufina. At least I'm starting in the port of Rufina because I'm on a ferry and I'm going to Naxos. But I just thought today I would make a video about Greek healthcare, both for those interested and those who need to access it. Now, unfortunately, I have a lot of experience of both the public and private healthcare systems here in Greece, not specifically for myself, but for family and friends. And I'm going to try and relate some of those experiences without getting too specific and personal for those individuals involved. But I'm going to split this video therefore into several sections. Firstly, I'm going to talk about how you actually access healthcare here. Then I'm going to talk about the public system and some of the drawbacks and benefits of that system, because it has both. Then the private system, and again, it has both benefits and drawbacks. And finally, perhaps options available for foreigners wishing to visit and live in Greece to access both. So I hope you enjoy this video. Now, I'm very conscious that healthcare is an emotive subject. My experiences of Greek healthcare, although extensive, are by and large very positive, if I'm honest with you. And I have a comparison. I compare it to the NHS in the UK, which I think is held up as an international standard. It has declined significantly, in my opinion, in the last few years. And I find that Greek healthcare is better than the NHS in the UK for three specific reasons. Firstly, it's accessible. Secondly, it is affordable. And thirdly, as with the NHS in the UK, it is competent. But the NHS in the UK has become very difficult to access and very, very expensive if you need to seek alternative private care. Whereas in Greece, that is not necessarily the case. But I'm also very conscious that everyone has to access healthcare at some point. And some of you who have used Greek healthcare will have very negative experiences. I'm absolutely certain of that, and I apologize for that. I don't wish to upset you with this video. I can only relate the experiences which I have had here in Greece, and I have had extensive experience here in Greece, and for me it has been largely positive. Should you find yourself in need of healthcare in Greece, there are really three options for accessing this easily and quickly. The first, in the event of an emergency, is the CAT. This is the Greek equivalent of the accident and emergency, and in most large towns and most large islands there'll be a hospital or a major health centre which will have a CAT department. Effectively, as I said, accident and emergency. Ask the locals, go online, you will find it, and go and attend it. Now, it has drawbacks, it has limitations. I will talk about those in a few minutes when I talk about public healthcare, but that is your first port of call. Should you need urgent support and urgent healthcare, seek out the CAT, K-A-T. The second option is the healthcare centres. Now, across the islands and across the smaller villages in mainland Greece, everywhere has a health centre. It may not be 24/7, it may only open between office hours, but there'll always be one or two doctors there, generally younger doctors who are doing their training after university. They get sent out into the regions by the government, but they will speak English. They will be very up-to-date and competent, and you can either attend that health centre without an appointment, or you can call up and make an appointment should your issue be non-urgent. Now, you will probably still have to pay for your medicines because you're outside of the Greek healthcare system, but it's very likely you won't need to pay for that appointment, and you will get valuable advice at any of these health centres. The third option is to go privately. Now, this is very easy and very accessible in Greece. Most major towns will have a number of private specialist doctors. You can find them online, you call them up, you make an appointment to see them within a day or two. It could be ear, nose and throat, it could be a dietitian, it could be anything of that nature. And they will charge you a very reasonable fee for a half-hour appointment, let's say 40 or 50 euros. They will diagnose what you need, they will write you a private prescription, and you can go and get that from the pharmacy. And in reality, it doesn't matter whether you're getting a private prescription and having to pay for it, or probably from the public healthcare system. As a foreigner, you will have to pay anyway because you're outside of that healthcare system, so you will end up paying for your medicines. But you have those three options. In emergency, go to the local hospital, the CAT. If it's less urgent, you can go to the health centres, which is within the public healthcare system, but you'll probably still have to pay for your medicines. And finally, you can go privately to any of these specialists. There are many to be found online, and it's very easy to access them. The public healthcare system in Greece is functional, but if I'm really honest, it is under tremendous strain. It's hugely underinvested and trying to make do with very limited resources. That said, the people are fantastic, the staff, the doctors, the nurses. They are making the best of a very challenging situation. But I want to give you a couple of examples just to set the scene for you. Should you go to CAT, should you go to the accident and emergency, it is likely to be extremely chaotic. and the infrastructure, the buildings, the environment in which you're in is likely to be pretty dilapidated, pretty poor. I've been to CAT with elderly relatives, and even if you're in a critical condition, you might spend 8 to 12 hours on a bed in a corridor before you're seen. It's that bad. Now, in reality, it's not that different to the NHS in the UK at the moment, which is a shame, but you need to be prepared for that. It is not an efficient, well-managed system. It is quite scary, particularly if you don't speak the language. And even if you do speak the language, it's pretty scary. Let's say you're then admitted into the public hospital system. You're given a bed, you go to the hospital, you're given a bed. Again, the hospitals are somewhat dilapidated, but there are staff. You will be seen by a doctor 2 or 3 times a day. There are nurses during the day. So, fantastic, good experience. The problem comes at night, because at night time, from about 8 p.m. till about 8 a.m., there are no nursing staff in these hospitals, at least in my experience. And I have some experience of this. Literally, the nursing staff disappear. So if you have an elderly relative who needs 24-hour care, you're not going to get it through the public system. It's a nightmare. So what do? Well, you have 2 options. Either your family create a rota and you stand in and you take turns to care for that individual through the night until the staff come back on at 7 or 8 a.m. in the morning, or you yourselves employ a nurse to come in at night and care for that individual. Literally one-on-one care. So you're in the public system, but you're having to pay within the public system for a private nurse to come in and care for your relative, which is probably what you have to do if they're in a fairly ill state, because unless you're a qualified nurse yourself, you're not going to be able to care for them in the way that they probably need. And there are 2 options here. You can go for a non-unionized nurse. These people are perfectly qualified, perfectly capable, very competent, but they might, say, be from Bulgaria or Romania or Hungary or somewhere like that. And they will charge you 50 to 60 euros per night to come in and care for your relative, and they will only care for your relative. The other option is to employ a unionized nurse, normally a Greek nurse, and they will charge you 90 to 100 euros a night. So about 30 to 40% more. There is an advantage to this in that the hospital only wants unionized nurses. Now, you would think that because you're helping the public system out, you're employing someone, you're bringing them into the hospital, you're taking the burden away from the hospital, they would be very happy with that situation, but they are not if the person is non-unionized. So they do security sweeps every 2 or 3 nights, and they kick out of the hospital any nurse who is non-unionized. So you might get a call at 2 or 3 a.m. in the morning from the nurse that you're employing to look after your elderly relative to say, I'm no longer in the hospital, they've kicked me out. Now, that individual will be back there the following night, but the reality is you then have to go at 2 or 3 a.m. in the morning to care for your relative until such time as this individual can go back in the next day. They won't do that with the unionised nurses. The unionised nurses, no issue. You can stay all night, but you're going to pay more. And if your relative is in there for 3 or 4 weeks, it gets very, very expensive. Let's say 100 euros a night. You could be talking 3,000 or 4,000 euros. It's ridiculous. But it is a reality of the public healthcare system in Greece. You have to be aware of it. It is chaotic, it is challenging, it is understaffed, it is underinvested. But for many people, there is no other option. And should you find yourself in it, I am just warning you now to be prepared for that. The private healthcare system in Greece, in my opinion, is a system of 2 halves. And I want to explain what I mean by that. But firstly, I will say that the private healthcare system in Greece is world class. The doctors are brilliant. They are often overseas trained, although they're Greek. They've spent time overseas, US, Germany, UK, Canada, wherever it happens to be. They invariably speak multiple languages, and they are working with the latest technologies in well-invested facilities or hospitals. It's brilliant, but there are 2 parts to this. The first is you have a condition which needs specialist treatment. It could be diabetes, could be a lung disease, could be anything. You're going to see a specialist. Well, it's very easy to see a specialist here, and it's relatively affordable. It's accessible and affordable. You can go online, you can find in most towns around mainland Greece and in some of the islands very good private specialists who will see you very quickly within 2 or 3 days, typically, and will charge you 40 to 50 euros for a half-hour appointment. They are world class. You go and see a dietitian, they will give you world-class advice. They will prescribe you privately medicines that you can go and get from the pharmacy and you pay for, and you can easily deal with long-term health issues that you may have and may need to deal with here in Greece, provided you can pay that 40 to 50 euros plus the medicines. The reality is, even if you're in the public system, unless you have an AMCA, and I'll talk about that in a minute, you're still going to have to pay for the medicines. So private, public, doesn't matter really. You're still going to pay for the medicines. 40 to 50 euros for a half-hour appointment. It's brilliant. The other side of the coin is private hospitals, because again, they're very accessible. You can go to a private hospital. There are some fantastic private hospitals here in Greece, but they are really expensive. Now, I'm not talking about US rates, but they are still pretty expensive and unaffordable to most people unless you have insurance. And I'll talk about insurance again in a minute. But I'll give you an example. IEA, which literally means health in Greek, is probably the #1 private hospital in Greece. It's based in Athens, on the Halandri-Marousi border. It's a very well-known hospital, privately owned, and highly confidence inspiring. You go in there, you are going to be treated by the best doctors in Greece, some of the best doctors in Europe. You are going to be probably diagnosed using the latest equipment, and you are going to stay in an environment which is very, very pleasant. It inspires confidence, it relaxes you, in contrast to what I said about the public system, but you pay for it. I've had elderly relatives in there. If you're paying without insurance, it's 600 to 700 euros per night for a shared room. That's just the bed in a shared room, 2 people per room. That doesn't include the nursing, that doesn't include the doctors, that doesn't include the medicines, that doesn't include the diagnostic treatments. All of that's on top. So you can end up, let's say they're in there for 10 days, you can end up with a 6,000 euro bill for the bed and another 10, 15, 20,000 euros for the doctors, the medicines, the treatments, etc. It adds up extremely quickly. So unless you're extremely well off and have fortunes that you can draw upon, you have to have insurance. But it does inspire confidence. So now we come really to the meat of the matter, I suppose, for some of you viewers, and that is, how do you pay for private healthcare here in Greece, or any healthcare here in Greece, because you want the peace of mind of knowing that you will be treated in the best way possible should you need it. And it really breaks down into 2 things. Are you resident here or are you a visitor here? So let me deal with visitors first. If you're a visitor, get a decent travel insurance policy. Doesn't cost a lot. Make sure it covers every eventuality, motorbike rides, rock climbing if you're going to do rock climbing, etc. And make sure it is for the duration of your stay, because God forbid something happens here, you need to be covered and you need the best treatment you can get. And I don't understand why people come here and they skimp on a travel insurance policy. Get yourself a decent travel insurance policy. Shouldn't cost you a huge amount of money. Even if you're here for several months as a digital nomad or something, get a travel insurance policy. Have that peace of mind. If you're British, you can also get an EHC, which is a European health card. You apply to the government via gov.co.uk, and I think it lasts 2 years, but this card effectively guarantees that if you go to a public hospital in Greece and you need treatment, the NHS will then effectively refund the cost of that treatment to the Greek government. You won't then pay. It's not a substitute for a travel policy. Don't think it's a substitute for a travel policy, but I would get an EHC. Why not? It's free and it allows the NHS to cover you in Europe, and I'm sure in other countries you have similar systems. Now, if you're a resident, the situation in my view is slightly more complicated and slightly easier as well. Let's start with a Greek healthcare number. If you're resident here and you are paying tax here, are by law entitled to an AMCA. An AMCA is the Greek healthcare number, and I would highly recommend getting it. You can go to the KEP, the Local Citizens Advice Bureau. It is law from April 2024 that they have to give you one, provided you are resident here legally and provided you are paying Greek taxes. And that will entitle you to emergency care, to access to doctors, etc. And yes, you'll probably still have to pay for medicines, etc., unless you're paying into the national insurance system. But it's well worth having an AMCA here. It facilitates things. I get my free flu jabs every year. Should I go to CAT and need it, there'll be no questions asked about payment, despite the fact I don't have a Greek passport. I only have a Greek ID card. So get your AMCA and push to get it, because sometimes they're a little bit tricky about it, but it is the law that you're entitled to it. However, if you're resident here, you really need to get domestic private health insurance if you can. Now, it's not hugely easy to get hold of. I have just redone with my wife our domestic private healthcare here, and I learned quite a few things from that, so I'm just going to relate them here very quickly for you. Firstly, if you're over 55, it is much more difficult to get private insurance here in Greece. It's not impossible, but it's much more difficult and might cost you more money. We were told categorically that there are several firms which will not insure you, but there are others that will. Now, we've gone with Generali. It's one of the big firms. There's Inter-American, there's Generali, there's Aviva, there's AXA, various big international firms who operate here. We went with one of the big firms, firstly because they would insure us, and secondly because it gives you a certain degree of confidence that if there is an issue, they will probably pay out. But payout is as much down to your broker as it is down to the insurance company itself. You have to go to these insurance companies via a broker. You have to get the policy via a broker, a real person, and the broker is key. You need to get to know your broker, because should you need to call upon that policy in the future, he is the one who will facilitate that, or she, and therefore it's very important that you have a personal relationship with them. Take them for coffee, get to know them, see them, I'm not saying regularly as a friend, but see them now and again, just to update them and have a coffee and make sure that they remember who you are, and should there be an issue in the future, they will be on your side. But we have this private healthcare policy. It covers us, I think, for €500,000 per annum each. It covers us for all eventualities, other than a couple which I'll mention in a second, and it allows us to have health treatment in any private hospital or facility here in Greece. It also gives us 12 private doctor's sessions per year, to a certain limit, I think €35 or something per session, but they want you to actively manage your healthcare, because obviously, potentially, that keeps their costs down in the future. And for all of that, my wife and I are paying €145 a month. I think that's a pretty good deal, but it was quite difficult to get. Firstly, as I said, you have to go via a broker. You have to have conversations with the broker. We were turned down by one company, but another company, no problem, Generali. And you then have to have a health interview. Now, this was with a nurse via a phone call, half an hour each, but we had this interview. They ask you various questions that are recorded, and you have to answer honestly, and if you don't, obviously they will use them in the future to nullify any claim that you make. But we now have private healthcare insurance here in Greece, and I would highly recommend it, because it gives you a peace of mind, provided you've been honest about it. Now, I said that they insure you apart from a couple of things. In the UK, you have two types of healthcare policy: pre-existing conditions, which is very expensive, and non-pre-existing conditions, which is anything that hasn't already happened to you, which is a bit cheaper. In Greece, they don't do that. In Greece, there's one policy, but what they might do is exclude a pre-existing condition for a period of time. So I have a minor condition that I've had since birth. It's very small, it's not a big issue, but they've excluded it for the first 2 years of my policy. This doesn't bother me. I think it's a much better way to do health insurance here. Now, if you're over 55, it's much more difficult apparently to get a policy here. Not impossible, but much more difficult. And an alternative you might have to look at is an international healthcare policy. Now, we used to live in Vietnam, and we had an international healthcare policy. They're much more expensive. There were 3 of us, my daughter included, and we were paying about €500 a month, or our company was, for this healthcare policy. But it gave us healthcare anywhere in the world other than the US. The US really ramps up prices if you include the US, and that may have to be a viable policy for you if you are over 55 in Greece and they don't offer you a domestic policy. There are other routes, but they cost more money. That's the reality. But whatever you do, don't come here as a visitor without a travel insurance policy that is appropriate to what you're planning to do, the activities, etc. And if you are resident here, try and get yourself some domestic private healthcare. Because if you can, particularly before 55, it's relatively cost effective to do so in comparison to the cost of ending up in hospital that I've already talked about. Inevitably, the quality of healthcare varies across Greece and dependent on where you are. The main healthcare, the main private hospitals, the main investment is in Athens. And often, if you're in the islands and you're taken very ill, you'll be medevaced via helicopter to Athens, because that is where the treatment, the real treatment is. In the islands, particularly the smaller islands, you may not have a big hospital. It may be a large healthcare centre. Even in places like Crete and Rhodes, for example, or Corfu, the hospitals may be limited compared to those in Athens, although a lot better than a lot of other places. So you need to be aware that the healthcare system here is a bit of an area lottery. Just depends where you are as to what you will find, and you may well have to go to Athens. Again, you can imagine being medevaced on a helicopter from an island costs a lot of money. You don't have a travel insurance policy that covers that. You are going to end up remortgaging your house. So I hope this has been useful. I hope You do not ever need to take this advice unless you're a resident here and you're getting some private healthcare insurance. But if you do find yourself in hospital, I wish you the very best of luck. There are worse places than Greece to fall ill. Thank you for watching. I hope you watch some of my other videos, and I look forward to doing more for you soon. Health providing.